You think it's just stress, but what if it's not? What if that constant overthinking, that tight feeling in your chest, that restlessness you can't explain, is actually anxiety? The problem is, most people don't recognize it, and even when they do, they don't know how to describe it clearly. Let's change that. We'll go through the key signs step by step, and I'll show you how this actually sounds in real clinical language. Part 1. What is anxiety? Let's start simple. Everyone experiences stress, but anxiety is different. Clinically, anxiety is a persistent feeling of worry, nervousness, or unease, often without a clear or immediate cause. A clean way to say it? Anxiety is characterized by excessive and persistent worry. Notice the words: excessive, more than normal; persistent, it doesn't go away. That's the key difference from everyday stress. Stress is usually linked to a specific situation. Anxiety can continue even when nothing is happening. In a clinical setting, you might hear, "The patient reports ongoing anxiety without an identifiable trigger." That phrase, "without an identifiable trigger," is very useful. Now, anxiety is not just mental, it affects the body as well. Heart rate increases, breathing changes, muscles tense up. So when someone says, "It's all in your head," that's not accurate. Anxiety is both psychological and physical. Part 2. Signs. Sign 1. Constant overthinking. This isn't just thinking a lot. This is when your mind keeps going, even when you want it to stop. You replay conversations, you imagine worst-case scenarios, you struggle to switch off. A patient might say, "I can't stop thinking about things, even small ones." In clinical language, you could say, "The patient reports excessive rumination." Rumination is a key word. It means repetitive, intrusive thoughts. Another strong phrase, "The patient describes persistent, uncontrollable worry." Take a moment and repeat that. Persistent, uncontrollable worry. That's exactly how it sounds in a clinical exam. Now, why does this happen? Because the brain is trying to anticipate danger, even when there isn't any. And that leads to the next sign. Sign 2. Restlessness. Restlessness is that feeling where you can't relax. Even when everything is quiet, your body doesn't feel calm. You might feel on edge, unable to sit still, constantly alert. A patient might say, "I feel like I can't relax." Clinically, you could say, "The patient appears restless and unable to remain still." Or, "The patient reports a constant feeling of inner tension." That phrase, inner tension, is very useful. You may also notice physical signs: fidgeting, pacing, tapping hands or feet. In an exam, you might describe, "The patient is visibly anxious and restless." Short, clear, professional. This is how observation becomes clinical language. Sign 3. Physical symptoms. This is where many people get confused, because anxiety often looks like a physical illness. Common symptoms include rapid heartbeat, shortness of breath, sweating, dizziness. A patient might say, "My heart starts racing for no reason." In clinical terms, the patient reports palpitations. That's a key word, palpitations. Another example, "I feel like I can't breathe properly." Clinically, the patient reports shortness of breath, or the patient experiences episodes of dyspnea. Now, here's an important point. These symptoms are real. They are not imagined. In fact, many patients think they are having a heart attack. So in a clinical setting, you might say, "Cardiac causes should be ruled out." That's a very strong professional phrase. Repeat it. Cardiac causes should be ruled out. This shows clinical reasoning, not just language. Sign 4. Sleep disturbance. Sleep problems are extremely common in anxiety. You may struggle to fall asleep, wake up frequently, wake up feeling unrefreshed. A patient might say, "I'm exhausted, but I can't sleep." Clinically, you could say, The patient reports difficulty initiating and maintaining sleep. That's a high-level phrase. Initiating sleep is falling asleep. Maintaining sleep is staying asleep. Another useful sentence, sleep is significantly disturbed, or the patient experiences non-restorative sleep. That means sleep doesn't feel refreshing. Again, simple idea, but precise language. Sign 5. Avoidance. This is when anxiety starts changing behavior. You begin to avoid situations that make you uncomfortable. For example, social situations, public speaking, crowded places. A patient might say, "I try to avoid situations that make me anxious." Clinically, you could say, "The patient exhibits avoidance behavior," or "The patient avoids anxiety-provoking situations." That phrase, anxiety-provoking, is excellent, because now anxiety is not just a feeling, it's affecting daily life, and that's when it becomes clinically significant. Part 3. Mini case. Let's put everything together. A 28-year-old patient presents with excessive worry, restlessness, poor sleep, and palpitations. Now let's say it clinically. This is a 28-year-old patient presenting with persistent anxiety, restlessness, and sleep disturbance. The patient also reports palpitations and excessive worry. These symptoms are consistent with an anxiety disorder. That's a complete, structured clinical statement. Simple, but powerful. Comment, task, and I'll send you PDF to practice the lexics. Like, subscribe, and follow for more medical English.